Hi everyone, today I am going to demonstrate on how to administer oxygen by oxygen mask. So the first step is to check the doctor's order. Next is bring all the necessary materials needed on the bedside stand or overbed table. Bringing all the materials needed will help us to perform our task efficiently and effectively because we don't have to go back and forth when we need something which is time consuming. Next is perform hand washing and put on PPE if indicated. Hand washing deters transmission of microorganisms and bacteria. Next is identify the patient. In identifying the patient, we have to use at least two identifiers. Ask the patient's name and check the patient's name tag and then compare these identifiers from the medication administration record to ensure that we are giving the right medication to the right patient. Hi, good morning. May I know your name, please? Thank you so much, Mrs. Santos. After identifying the right patient, you can now close the curtain around the bed and close the door to the room to ensure patient's privacy. Next is explain the procedure and the reason for doing it to the patient, and then review safety precautionary measures when the oxygen is in use, and don't forget to place a non-smoking sign in the area as needed. Explanation will lessen the patient's anxiety and discomfort toward the procedure, and then placing a non-smoking sign will prevent possible accident. Mrs. Santos, I will be administering oxygen by oxygen mask, and then this will help you breathe normally, okay? Thank you very much. Next is attach the face mask to the oxygen source with humidification, if appropriate for a specific mask. And then start the flow of the oxygen at prescribed rate. And if the face mask has a reservoir, allow the oxygen to fill the bag before going or proceeding to the next procedure. Next is position the face mask over the patient's nose and mouth. And then adjust the elastic strap so that the face mask fits snugly but comfortably on the face. And then adjust the flow rate at prescribed rate. Next is, if the patient reports irritation or redness is noted, place a gauze pad under the elastic strap at the pressure point to reduce the irritation on the patient's ear and scalp. Next is reassess the patient's respiratory status, including respiratory rate, effort, and lung sound. Note for any kind of respiratory distress like tachypnea, nasal flaring, and use of accessory muscle. Next is remove PPE if used and perform hand washing. Again, hand washing prevents transmission of microorganisms and bacteria from one person to another. Next is remove the face mask and dry the skin every 2 to 3 hours if the oxygen is running continuously. Do not put any powder around the mask. And then lastly, document the procedure, findings, and results, and don't forget to sign the medication administration record properly. And that concludes my return demonstration on how to administer oxygen by oxygen mask.